Today's training topic is ergonomics. Specifically, how to avoid sprains and strains. Ergonomics is a way to work smarter, not harder, by designing tools, equipment, workstations, and tasks to fit the job to the worker, not the worker to the job. Musculoskeletal disorders, or MSDs, are defined as injuries and disorders that affect the human body's movement or musculoskeletal system, muscles, tendons, ligaments, nerves, cartilage, blood vessels, etc. MSDs are also known as cumulative trauma disorders, CTDs. Repetitive strain injuries, RSIs. They are soft tissue injuries which are chronic, or typically occur gradually over time. Work-related MSDs are caused or made worse by work methods and/or the work environment. They occur when the physical capabilities of the worker do not match the physical requirements of the job. MSDs may also be caused by exposure to a combination of ergonomic risk factors. They can occur as a consequence of overuse of muscles without sufficient recovery time, pushing, pulling, carrying heavy loads, awkward posture/poor body mechanics, repetitive motion, excessive manual handling, hand-intensive work, vibration/contact stress. The common symptoms of MSDs are as follows: discomfort, shooting pain, painful aching joints, numbness, tingling, loss of strength, burning sensation, swelling or inflammation, change in color, tightness, and the loss of flexibility. The most common types of MSDs are tendinitis, epicondylitis, bursitis, carpal tunnel syndrome, muscle strains, and lower back injuries. Tendinitis is the inflammation of tendons. Epicondylitis is inflammation of tendon sheaths. Bursitis is the inflammation of bursa. Carpal tunnel syndrome is the swelling of tissue in the fingers and wrists. This puts pressure on the median nerve. How do you recognize the risks of an ergonomic injury? You must understand the physical risks of lifting any object and the force required to move that object. Know the risks of performing repetitive tasks or motions. Understand the body motions required to complete a given task. Watch how others work and recognize where and when people are struggling. Listen to your coworkers and ask them what tasks are physically challenging. When you watch someone perform a task, ask yourself if it would cause you pain to do that task repeatedly. Basic training is all that is required to understand and recognize the risks of ergonomic injuries. When suggestions or complaints are received, fix the problem before it causes an injury. When employees are complaining of aches or discomfort, it may not be their fault. Oftentimes it is the failure of management to act. Management failures include the following: missed opportunities to implement improvements before an injury occurs, inconsistent enforcement of lifting limit policies, ignoring good employees doing the repetitive work until it's too late, not recognizing hazards or leading indicators, failure to complete corrective actions that led to previous minor incidents, not involving workforce in improvement implementation, not challenging ourselves to get better, putting up with it, overlooking automation when manual tasks have been just fine, walking past dated workstations, furniture, working surfaces, and makeshift tools. It is important to take action before the aches and pains become injuries. Engineering controls are always the first choice when implementing preventative measures. Focus on workstation design and physical changes. Can motions be automated? Look at the equipment, tool design, and selection that employees are using. Administrative controls are the second choice when trying to minimize ergonomic injuries. Try to rotate employees from one job task to another. Implement new policies, training, and procedures. Hold employees accountable for breaking lifting rules. Allow employees to take micro breaks and stretch between tasks. When you are unable to perform engineering or administrative controls, the last step would be to implement personal protective equipment. Ergonomically designed equipment to improve dexterity or comfort. Always involve the workforce in solution implementation.